Hi everyone, I am Deveshi Shivani from Vista Del Lago High School, Folsom, California, and welcome to the eSecondOpinion.org Health Series. Our mission is to empower you with the knowledge and confidence to make the best health decisions, especially when facing challenging diagnoses like breast cancer. Today, we are honored to have Dr. Raja, a leading expert in cancer care, join us to discuss the latest advances in breast cancer diagnosis and treatment. We'll also explore how getting a second opinion can be a crucial part of your health journey. About Dr. Raja. Thiru Rajagopal, MD Fax, is a general oncology surgeon who has been serving a diverse group of patient populations over 30 years in Sacramento community hospitals. He's the founder and CEO of Sierra Health Alerts, dedicated to promoting preventive care and population health. Dr. Rajagopal has had the opportunity to work with Dignity Healthcare System at different levels. He has served as the Chief of Staff, Medical Executive Committee member for Mercy General Hospital, and also an ex-official board member for Sacramento Community Dignity Hospitals. He is an advisor to health plans like River City Medical Group, a sectional chief for Hills Physician Medical Group, and a medical director for Nirvana Independent Physicians Network. Doctor Rajagopal was also a fellow for American College of Surgeons and an active member with the American Society of Breast Surgeons. Furthermore, as a faculty member of California North State University, Dr. Raja mentors future physicians. Dr. Raja is a physician with enormous passion to address the healthcare needs of minority communities with complex medical issues like breast cancer. In the United States, about 1 in 8 women, roughly 13%, will be diagnosed with breast cancer at some point in their lives. In 2025 alone, approximately 317,000 women and 2,800 men are expected to be diagnosed with invasive breast cancer, along with an additional 59,000 cases of non-invasive cancer. That means a woman is diagnosed every 2 minutes, and breast cancer will account for 30% of all new cancer cases among women in 2024. Fortunately, in most cases, about 66% are detected early, before the cancer has spread beyond the breast. The average age at diagnosis is 62, though 9% of cases occur in women under 45, with younger patients facing a higher risk of reoccurrence. Overall, the 5-year survival rate for breast cancer is 91%, with survival rates of 99 for localized, 87 for regional, and 32% for distant stage cancer. Yes.
Okay,
What is breast cancer and how does it affect the body?
it's a good beginning. Okay, well, cancer in general is abnormal growth of cells due to aberration in the genes. Okay, normal cell cycle usually they stops. The process called apoptosis. They grow, then they die. Cancer cells they escape. So in breast there is an abnormal focus. So it keeps multiplying without a control. It affects locally as well as at the distant places by a mechanism called metastasis.
Okay, thank you. And another question is, what are the different types of breast cancer and how do they vary?
Well, breast cancer is a very diverse condition. We call it heterogeneous. Not all the breast cancers are same. They're all driven by tumor biology, by genetics. Okay? Even though we consider breast as a one organ, within the breast there are several kinds of cancers can start. It can come from the milk tubes called ductal cancer, that is a conduit pipeline between the milk glands to the nipple. So most of the cancers they come from the milk ducts. About 10 to 15% of the cancers they come from the milk glands called lobules. Then some cancers come from the supportive connective tissue. You need a supportive tissue for any cells. Okay, so it could be different. They all behave differently, driven by a signature genes. You probably aware of it. You read the biology. You can't escape without knowing genetics, correct? And so they're all driven by a signature genes. Some of them are very slow growing. Some of them are very aggressive. That is determined by the molecular subtypes. That is still different. Some of them, they carry some proteins called receptors on the cell surface. They influenced by your circulating hormones. The females have estrogens and progesterones coming from the ovary. Deeper in the abdominal cavity, adrenal glands. Males also can get breast cancer. So about more to 60 to 70% of the breast cancers, they are all influenced by the hormones secreted in the body. The rest, 30%, they are little diverse. They grow differently, they behave differently, they respond to treatment differently.
Okay. So Bill, and after that, what are some common ways doctors can diagnose breast cancer?
Well, there are several ways of diagnosing the breast cancer. One clinical exam is called self-examination. It used to be the practice in the past. Nowadays, we don't recommend is the one way of diagnosing breast cancer by clinical examination, because in order to feel, we call a palpate, a tumor or a growth, it has to be certain size. Okay? Nowadays we identify these cancers at a very, very early stage. So the most common tool we use is called mammogram. It's basically an X-ray technique. There are several kinds of mammograms: digital mammogram, 2D and 3D. Now, most commonly we use 3D mammogram. Is called tomosynthesis. They make multiple slices, okay, and they go a little more deeper. It reduces the false positive and false negatives. Especially it helps some of the challenging breast conditions, people who have a very dense breast. It's very common among young people. The next commonly used tool is an ultrasound. It's a totally non-invasive. Mammogram has X-rays. Radiation effect will be there. Even though it's very minimal, but still it carries some risk. Whereas ultrasound is totally non-invasive, but it cannot identify all the cancers. Some of the breast cancers, they may not show a mass. They may have some calcium deposits along the milk tubes. Ultrasound is not very good for that. But it will tell whether there is a mass there or a tumor there. Is it a solid or is it a liquid? And it emits some shadows. Based upon the shadows, we can identify whether it's an invasive, non-invasive. Okay, cancer can be invasive cancer, non-invasive cancer. Majority of them are invasive. About 25 to 30% of them are non-invasive. That's called in situ cancers or ductal cancer in situ. Okay. Then the other modality we use is MRI. MRI is very sensitive, but it has associated a lot of false positives. Okay. The MRI depends upon injection of some contrast material that enhances increased vascularity in the tumor, that unnecessarily subjects to the unnecessary biopsies, unnecessary procedures. So we don't use MRI as a gold standard. Mammogram is still gold standard, even though it has some limitations, especially with the younger population below the age of 40. Okay? Then other tools we use is called PET scan, positron emission tomography. There we use some isotopes. It helps in staging and also identifies metastasis elsewhere, and also response to treatment. These are the conventional methods we use it. Then comes all the latest technologies we have now, which I have to mention now. Is called liquid biopsies, where we can take a body fluid, usually a drop of blood or any body fluid, and we give to what is called next generation sequencing. It identifies, what kind of cells, what kind of genetic makeup it has. So now it is currently in use in so many cancers, including breast cancers, for various purposes.
Okay, thank you for the response. Diving deeper into the topic, how does breast cancer affect people differently based on ethnic background or genetic factors?
Good. As I told you earlier, each cancer is driven by the genetic makeup. For instance, breast cancer, there are several varieties. One is called HER2 positive breast cancers and triple negative breast cancers. What I mean is, HER2 is a oncogene. What I mean is, it's a cancerous gene. It actually kind of a modulator how the cells grow. So if some cancer has a overexpression of a particular HER2, that is human epithelial receptor, it's a protein basically. If they have too much of those protein, it amplified and it causes more cell to grow. They are a little aggressive. And some cancers, especially with the breast, as I told you, it's a diverse, triple negative. They do not carry any of the proteins. No ER, PR, estrogen progesterone receptors, okay? No HER2 receptors. Receptors means a protein basically. And they behave totally different. Interestingly, some of those triple negative cancers, they also have mutation produced by genes. The most common genes we come across, BRCA1 and BRCA2. There are about 80 genes associated with breast cancer. Okay? So they also drive that. Coming to ethnicity, well, breast cancer is more common among the white population, then less common with the African Americans, even lesser with the Hispanics. Okay, Asians somewhere in between. It is due to several factors, several reasons. Okay, even though the breast cancer is less common in African Americans, but when they have a cancer, it's usually aggressive, and it also happens at the younger age.
Okay, continuing, what are some lifestyle choices young people can make to reduce the risk of developing breast cancer?
That's a very good question. Okay, well, I'm trying to explain for an 8th grader or 9th grader level, because it's very important for a kid like you. Lifestyle changes is very, very important. How you are going to live, what kind of disease you are going to catch. Okay? Starting with, what are the food you are eating? Okay? There are some foods, they are not necessarily good. Saturated fats. Okay? They definitely, it has been known, creates obesity, it also creates other problems associated with it. Physically active. Okay, that's also very important. People indulge in vaping, especially younger population, smoking. The nicotine has a deleterious effect it has. Overconsumption of alcohol, it has. Then from the atmospheric, there are a lot of environmental factors they also introduce. So starting from how you lead your life, eating good vegetables, avoiding processed food, whole grain, nuts, plant-based food, all these things are helpful. And being physically active, that also helps you. Your metabolism in good shape. Avoiding alcohol, smoking, that all makes a lot of difference.
Okay, just as I'm in high school currently, how can schools and communities help educate young youth about breast cancer prevention?
Yes, there are several ways. Okay, starting from the youth, parental guidance. It starts from home. What kind of food you eat, how you lead your life, okay, at home. Then comes to the school. School has a lot of clubs, wellness clubs there. Okay, some of the students, they are the ambassadors. They involve how to improve the wellness of the students there. They talk about diet, they talk about other habits regarding again smoking, alcohol consumption, vaping and all those things they can do. Then there are a lot of non-profit organizations, they reach out. American Cancer Society has a lot of platforms to educate what is important. Few things they educate people is, well, number one, how your biologic clock works. Okay, are you taking a lot of hormone preparations, contraceptives, all those things? It can talk about it. Then it can also tell about when you want to get pregnant, what is the advantage and disadvantage of getting early pregnancy versus delaying the pregnancy, the advantage of breastfeeding, what should do, how it helps. Okay, it can also give you an idea about the importance of family history. Suppose your first year relatives, your sister, mother, somebody, what kind of impact it has. If somebody is a second degree, your aunt has, what kind of impact it has. And what kind of atmosphere, environment you are living. So, non-profits do that. American Cancer Society does it. National Cancer Institute has it. Then local community organizations, they also help you. Then visiting lecturers, like person like me can also come and talk to you about this because it's the most common cancer among the women. Okay? Then institutions, healthcare institutions, insurance companies, local hospitals, they can conduct forums, health fairs, they come and educate.
Okay, then how can seeking second opinion improve the accuracy and confidence in breast cancer diagnosis?
Good. The second opinion is a part and parcel of treating the breast cancer now. Why I say is, we don't treat the breast cancer just with one guy making a decision. It's a shared decision making between the patient as well as the doctor, treating doctor. But it is supported by multidisciplinary approach. There's a team of doctors, a pathologist, a radiologist, a medical oncology is a cancer specialist, a surgeon, then supportive services. They all come together. Then we sometimes present in a dedicated tumor board. We discuss each case individually. Then we draft a treatment plan. Okay. So number one, it improves the confidence with the patient and it gives you a lot of peace of mind and also it empowers the patient. Ultimately, it really come up with more accuracy and it reduces a lot of subjective things and also it reduces over-treatment and also improves the under-treatment. Overall, it helps the patient in so many ways. And it brings the confidence in the treating physician.
So then what are the differences between local treatments like surgery and radiation and systematic treatments like chemotherapy and hormone therapy?
Good. See, cancer nowadays is considered as a systemic disease. Okay? Even though we call it a breast cancer. Breast cancer doesn't just start at the breast and stays there. It is influenced by a lot of things within our body. So it is considered as a systemic disease by National Cancer Institute now. Okay? So there are so many ways of treating the breast cancer. Surgery, radiation. Of course, they are all local control. Local control is good, it's the early stages. Okay? But it's a systemic disease, so you need to treat the entire body by a chemotherapy, immunotherapy. Okay, there are so many ways of doing it.
Okay, then how does getting mammograms help in early detection?
Good. As I told you, mammogram is the gold standard, but it has some limitations below the age of 40 because the breast tissue is so dense. Breast needs a contrasting features. In people get older, the ductal system get atrophied and there are a lot of fat, so it helps them. Early detection is the key for a better prognosis. Over the years, we are able to achieve marked reduction in the mortality rate with the breast cancer. Okay? One of the reasons is early detection with the mammogram. The mammograms can detect the cancer as much as up to 5 millimeter easily. Okay? So definitely that helps.
And who should get these mammograms?
Yes. There are different guidelines. The one I recommend is American Cancer Society guidelines. There's radiological societies, they have different guidelines. I belong to American Society of Breast Surgeons, we have different guidelines. But ACS, American Cancer Society, has a guidelines. They recommend doing the mammogram, screening mammogram, okay, at the age of 40. It is not mandatory. Suppose you have somebody has a family history of breast cancer or some other high risk factors, we recommend them yearly mammogram. Otherwise, start at the age of 45, annual mammogram till the age of 54 or 55. Then up to that, they recommend every 2 years. As long as your life expectancy is more than 10 years, you should follow that. Some high risk people, we also recommend MRI starting at the very early age of 30. What do you mean by high risk? Somebody may have some mutation in the genes in the system. They're inherited. 5% of the people inherit those genes. So there we start an MRI early stage. So mammogram definitely helps early detection.
Okay, so then how is AI transforming breast cancer screening and prevention, and what impact does it have on early detection?
Yes. See, AI is a very novel tool, but it's a very powerful tool now. AI has penetrated every area in the healthcare system, starting from the diagnosis, monitoring, surveillance, everywhere. From coming to the diagnosis, it definitely helps the radiologist. It reduces the false positives, false negatives, AI. Okay? Especially when they look at the mammogram or an MRI or ultrasound images. It also helps the pathologist. There are certain gray areas. Some of the abnormal looking cells under the microscope, they do not know to fall which side, whether it is totally benign or is a low grade cancer or something like that. AI definitely improves. The confidence level goes up. Okay? Then AI also used in other areas. During the surgery also it helps me. When they cut the tumor, we want to see the margin, everything is okay. So I can use AI in the operating room to find out whether I have a clear margin or not. Okay? Then following a treatment, AI can also predict who is going to recur, how fast, or they're responding to particular treatment in the surveillance. So AI has a bigger role. In the future, not only in the future, even today, we have to incorporate AI in every section of medical care now. Only limitation of the AI is the human connection. It is not an emotional tool. It's a technical tool.
Okay, so thank you so much, Dr. Raja, for sharing your valuable insights with us today and giving this opportunity to spread awareness about this crucial topic through e-second opinion.